Whew, bleeding in early pregnancy can be scary, downright terrifying, actually. If you see even a small spot of blood, your mind goes straight to the worst case scenario. But here's the truth. Sis, bleeding in early pregnancy isn't always a sign of trouble. Sometimes it's your body adjusting, sometimes it's that tender tissue doing what it does, and sometimes it's just timing. So today I'm going to break down the most common reasons bleeding happens in the first trimester and how to know when to breathe and when to call your doctor. Because yes, bleeding in early pregnancy can look alarming, but it's not always a reason to panic. And by the end of this episode, I pray you'll feel calmer, more informed, and more supported. I'm Dr. Tiffany Woodus, your sister in this journey, and a board-certified OB-GYN committed to improving Black maternal health outcomes. Because your 15-minute prenatal appointment is not enough. I'm here to give you calm, clear guidance you can trust. And if you ever find yourself wishing for a safe space for real answers from experts who look like you, come and hang out with me and the village at melaninmaternity.com, where you get expert on-demand access to Black maternal health specialists and a community that holds you up. Let's start here. Bleeding in early pregnancy is actually pretty common. About 15 to 25% of women will notice some type of spotting or light bleeding in the first trimester. That's roughly 1 in 4 mamas. And most of them go on to have perfectly healthy pregnancies. So if you've seen a little pink or brown when you wipe, take a breath. You are not alone. Let's talk through what might be happening. First, pregnancy makes your cervix and vaginal tissue softer, more sensitive, and full of new blood vessels. That means something as simple as a pelvic exam, a little intimacy, or even strenuous activity can irritate those tiny vessels and cause light spotting. That's called contact bleeding, and it's common, not dangerous. Next, vaginal infections like yeast infections or bacterial vaginosis can inflame those same tissues. That irritation can make them fragile and bleed a little, especially when wiping. Once the infection is treated, that spotting usually stops. Then there's implantation bleeding. It can happen about 10 to 14 days after conception when that tiny embryo nestles into the uterine lining. It's usually just a few spots, lasts a day or two, and stops on its own. So sis, if you're around 4 to 5 weeks, saw just a little pink and your pregnancy test is positive, sometimes that's your body doing what it's supposed to do. Now let's talk about polyps and fibroids. Polyps are small, benign growths from the lining of the cervix or in the uterus that can bleed easily. And fibroids, which many of us Black women are all too familiar with, can also lead to light bleeding. Neither means your baby is in danger. It just means that we'll monitor you and make sure that everything is okay. Another cause is something called a subchorionic hematoma, or SCH. It's a small pocket of blood between the uterine wall and the early placenta. Sometimes you'll see spotting or even heavier bleeding like a period, and sometimes it's only found on an ultrasound. Most of the time, these resolve on their own within a few weeks. Your provider might recommend pelvic rest or even a follow-up ultrasound. The key is patience and reassurance. You didn't cause it, and it usually doesn't harm the pregnancy. If you've heard that term before, take a deep breath. Watchful waiting is the plan, and you are not alone while you wait. If this conversation is bringing you peace or answers, come and go deeper with me inside the village at Melanin Maternity, where we unpack topics like this every week with experts in real time. Because your 15-minute prenatal appointment is not enough, and you deserve a village that educates, uplifts, and sees you. Join us at melaninmaternity.com.
These are the worst mistakes Black women can make when choosing an OBGYN, assuming they'll automatically prioritize your safety, ignoring the signs when they dismiss your concerns, and not having a plan to advocate for yourself. Sis, I've been there, and that's why I'm so glad I found the Mocha Maternity Survival Guide, Choosing the Right OBGYN. This guide gave me everything I needed to avoid those mistakes, from conversation starters to tools for assessing their care. It's the ultimate roadmap to make sure you're seen, heard, and protected. Don't take chances with your health, Get your copy today and make the choice that could change everything.
Now, sometimes bleeding needs more attention. Here's when you should call your provider right away. Bleeding that's heavier than a period or passing clots. Strong cramping or one-sided pain, feeling dizzy, weak, faint, or experiencing shoulder pain. Or if you haven't had an ultrasound yet to confirm the pregnancy is in your uterus. These can be signs of a miscarriage or an ectopic pregnancy. That's when the pregnancy grows outside the uterus, usually in a fallopian tube. It's rare, about 1 to 2% of all pregnancies, but serious. Don't wait if something feels off. Your body whispers before it screams. Now, I want to pause and speak straight to your heart because I know the guilt that can come when you see blood. Most miscarriages are because of a chromosomal abnormality. It's not something that you did or had any control over. It wasn't that cup of coffee. It wasn't that walk, not that dance class, not that one drink you had before you realized you were pregnant, and definitely not intimacy with your partner. So please, sis, take the blame off your shoulders. You did not cause this, and you cannot control this. Okay, let's switch gears for a moment. Here's what you can expect when you come in for an evaluation. An ultrasound may be done to check for a heartbeat and to make sure the pregnancy's in the uterus. Blood work to measure your pregnancy hormone or beta-HCG levels over a couple of days. A quick exam or maybe even a swab to screen for infection. Each step helps us to see the full picture and guide you safely.
Think about it. How many hands helped raise you? How many voices spoke life over you? How many arms held you close? Black family is deep, and at Melanin Maternity, we celebrate every single part of it. We're not just a shop for mamas. We're a love letter to the entire village. From keepsake birth announcements that honor your newest blessing, to new dad gifts, to presents for the grandma who still prays over you. We have gifts that tell your family's story. Looking for holiday gear that actually represents us? We got that too. Because whether you're the one having the baby or the one making sure the baby always has love, you deserve to be celebrated. Shop Melanin Maternity on Etsy today by visiting melaninmaternity.etsy.com. Because our families, our stories, and our legacies deserve the spotlight.
In closing, it is all about perspective, and this is what I want you to remember. Light spotting happens in about 1 in 4 pregnancies and most in healthy births. Subchorionic hematomas usually heal on their own. Ectopic pregnancies are uncommon, 1 to 2% of pregnancies. But you will always hear me say, if you're worried, call your doctor. You deserve reassurance, not anxiety. Sis, if you've been carrying worry or shame, I want you to lay it down here. You are not broken, and you are certainly not alone. Come and join me at Melanin Maternity, where we have experts, education, and guidance waiting for you, because your 15-minute prenatal appointment is not enough, but your village can be. Bleeding in early pregnancy can be frightening, but it isn't always a crisis. Sometimes it's your body just stretching, adjusting, and growing in ways unseen. I'm praying for peace over you today. I'm praying for peace over your body, your baby, and your mind. You are doing better than you think. I'm Dr. Tiffany Woodus, and this has been the Blackbird Stories podcast. Stay informed, stay empowered, and always remember you are not alone.
Want to go deeper? The conversation doesn't have to stop here. Join Melanin Maternity, our digital Black birth community, where you'll get expert guidance, real support, and a sisterhood that sees you. From live Q&As with birth experts to empowering discussions with other Black mamas, we've got you covered. Click the link in the description and step into the community you deserve.